Assalamualaikum students. In our last lecture, we have discussed immunocompetency, hematological assessment, and today we will continue hematological assessment. And we will discuss specimen types, urine analysis, stool analysis, assessment of the hydration status. To assess the total body content of the nutrient specimen to be tested and the best common specimen for the nutrient or the nutrient related substances analysis include whole blood in which RBC, WBC, platelets, serum, and the serum is a basically fluid obtained after the blood is clotted and centrifuged to remove the clot and the blood cell plasma transparent liquid component of the blood containing inorganic electrolytes, clotting factors, other urine test or tissues test in which biopsies or blood spores. Other specimens that are used to check the nutrient content of the body are feces, breath test, hair and nail, and saliva in feces if the nutrient losses is increases or so to check or assess the nutrient content and um, we use this specimen and for in kidney diseases especially when protein losses increases or in liver diseases we use this specimen or this test and other is a pre-test for if abnormal metabolism to check the metabolism malabsorption and hair and nail test and saliva test the in case of hair and nail test one drawback they are no standardized procedure and for processing or assess and quality control and in hair test or nail hair test is mostly used in DNA testing or to check the medical nutrition therapy, predict the or effectiveness of the medical nutrition therapy. We have already discussed about transferrin and transport protein and so we discuss today about total iron binding capacity. The total iron binding capacity TIBC is a measure of all proteins available to bind mobile iron and depends upon the number of binding sites. And transferrin saturation reflects iron availability to tissues. To calculate transferrin saturation, serum transferrin divided by TIBC total iron binding capacity multiplied by 100. When amount of stored iron is decreases, so dietary intake of iron is low and saturation of transferrin is low. So when amount of stored iron available for release to transferrin decrease, transferrin saturation is decreased and iron intake is also decreased. In case of iron deficiency, the total iron binding capacity is increases and transferrin saturation is decreases. And in case of hypoxia during pregnancy, um, during estrogen replacement therapy, TIBC is increases and TIBC is decreases during nephritis, and transferrin decreases with PEM, protein, energy malnutrition, fluid overloaded, liver diseases. Total iron binding capacity and transferrin saturation. These tests cannot detect decreasing iron store and iron deficiencies. Low level of folate indicate deficiencies, and deficiencies are diagnosed by analyzing CBC, plasma, vitamin B12, folate levels. CBC may indicate megaloblastic anemia, but this could be a sign of vitamin B12 deficiency. Serum folate level reflect folate status, but erythrocyte folate level better reflect tissue store after intake. So, serum folate test is also important to diagnose the anemia. Serum B12 like folate anemia associated with B12 deficiencies can be diagnosed in several ways. Clinical, it will be similar to folate deficiency, but measuring serum vitamin B12 levels or different tests, performing different tests. In this test is given as injection and amount excreted in urine is measured. So in a CBC, we done CBC, they are difficult to diagnose. Either it could be serum B12, anemia, or folate. So there are different other tests to precise diagnose either what type of anemia. Stool testing, or if any person have GI issue or diarrhea or celiac diseases, so stool test is important, or any infection, malabsorption. In status of the GI flora, the amount of types of bacteria present in gut, fecal samples may be tested for the presence of the blood or pathogens. The patient with chronic GI symptoms uh, such as maldigestion or unexplained weight loss, weight gain, these tests be helpful. In case of kidney diseases or to diagnose the metabolic disorder or diabetes, and the urine analysis is important tool to diagnose. In urine analysis we check the pH, protein, glucose, ketones, blood, bilirubin in pH. If the person is using high protein diet or acidosis, for example, uncontrolled diabetes or starvation, its pH is acidic. And in case of when person is using uric acid medicines, its sometimes pH is also acidic. And in kidney stones and alkaline consuming diet rich in vegetables or dairy products, or in those with UTI, or after meal, if we check after meals or using some drugs. And protein losses increases those in which kidney diseases, nephrotic syndromes, mostly in nephrotic syndrome. And glucose, mostly glucose is positive those with diabetes mellitus or disease starting stage. Ketones positive in those with control uncontrolled if uncontrolled diabetes, then ketones are present, or if fever, anorexia, GI issue, vomiting, fasting, starvation, blood, and if blood is appear in urine, it indicate uh, infection, trauma, or injuries, bilirubin, and bilirubin is present in those with increase in certain liver diseases, gallstones, in hospitalized patient, or even with dealing with OPD's patient. Assessment of the hydration status is also important. In assessment of the hydration status, overhydration, we assess in overhydration and dehydration. Dehydration when water loss is increases due to temperature, any diseases, or low intake, or various reasons. So due to this, the water losses increases, and that causes a dehydration, or like in case of diarrhea, vomiting, and overhydration. Other name is edema. Uh, Overhydration caused by hydrostatic pressure, capillary increases the hydrostatic pressure in capillaries, or decreases the colloidal osmotic pressure in cases of the liver diseases and kidney diseases. Overhydration is occur, edema or and ascites is most common. So, in different diseases like in diarrhea, vomiting, water loss is increases, and in liver diseases, kidney diseases, water loss is decreases. Is a store and form of the edema and ascites.